Good evening. Thank you. There's a center welcome for you. I'm Melanie Benjamin. I'm the philanthropy director here at the center. It's my great pleasure to welcome you to Medicine and Society, Stories of Dementia, Caregiving, and the Human Brain. The center's mission is to create healthy aging opportunities for individuals 50 and better. Salute. Yay. 50 and, oh, come on guys, you can do this. Better through social engagement, physical well-being, civic involvement, creativity, and lifelong learning and volunteering. Show of hands, who amongst you has never been to the center at Belvedere before? Welcome, welcome. Yeah, and everybody tell them how great it is and that they need to be involved, right? Thank you. There's cookies back there for everyone. If you are impressed by what you experienced this evening and want to learn more about the center and its programming, please check out our brochure at the welcome desk that you passed when you came in through the front doors. We'd love to host you for more activities. One of the ways the center actually supports healthy aging is through partnerships with community leaders like the University of Virginia. Dr. Justin Mutter is Director of Health Humanities Programs for UVA Center for Health and Humanities and Ethics, and serves as the section head for geriatrics at the UVA School of Medicine. Before I turn the mic over to Dr. Mutter, I'd like to kindly suggest that for those of you who have a device that looks like this, that you turn the little button to the red side, which I've recently learned is off. There was a bad experience, but I'm not going to share that part. Also, please take advantage of the restroom facilities that are just outside the door should you need. And my understanding is there will be time for Q&A if I wrap this up quickly. So welcome. Thank you so much for coming. And I will turn it over to Dr. Mutter.
Well, thanks. Thank you, everyone. So glad to see so many people joining us here live, but we also have a Zoom going. And so we want to make sure we welcome our Zoom participants tonight. So everybody, welcome. I think we have a great conversation planned for tonight. We're so glad that you have decided to spend some of your evening with us. This is a topic and a concern that touches all of us in this audience. In fact, the studies suggest that it will touch all of us at some point in our adult lives, no matter who we are, whether our immediate family or our friends. And we are very honored to have Dasha Kiper with us tonight. As she reminds us, caregiving is ubiquitous. It is something that is everywhere. And its challenges, its beauties, all of which we will talk about tonight, they are universal. And so I think what we will be discussing has a lot of resonance with a lot of people. As Melanie said, I'm Justin Mutter. I'm the director of our Medical Center Hour. I'm a geriatrician at UVA. Our Medical Center Hour is a program of the Center for Health, Humanities, and Ethics at UVA. And this Medical Center Hour has actually been running for over half a century. And I think I was looking at the information, it's actually been running for about the same amount of time that the center has. So this is a real special partnership tonight event. I want to thank our friends at the center for hosting this and bringing us all together tonight for this event and this wonderful space. I also want to thank some of our sponsors. For the Medical Center Hour, we are very grateful for the Koppka Family Foundation that has helped make tonight possible. In honor of their father, the Koppka family has cultivated many conversations over the years with the Medical Center Hour through a deep commitment to fostering fruitful dialogue about communication in healthcare, communication between patients' families, communications between healthcare providers and patients and families, all in service to building therapeutic relationships. And those therapeutic relationships, as we all know, are the foundation for all health. Communication is hard. Communication is vital. And the cornerstone of what we'll be discussing tonight as we learn how to better care for one another in the context of dementia is communication. So there's a lot to talk about. We're very excited to dive in. I want to first introduce my friend and colleague, Dominique McLaughlin. Dominique is a consultant and counselor with the UVA Faculty and Employee Assistance Program. As a caregiver herself, in addition to facilitating a caregiving support group for UVA employees, she's very passionate about both self-care and elder care. And thanks so much for joining our conversation tonight. And a special warm welcome to Dasha Kiper, whose book, Travelers to Unimaginable Lands, Stories of Dementia, the Caregiver, and the Human Brain, is transforming the way we think about caring for one another, caring for those with dementia disorders, and caring for ourselves. And in addition to authoring this great book, Dasha is the former consulting clinical director of support groups at CaringKind, which is formerly the Alzheimer's Association New York City chapter, and she holds an MA in clinical psychology from Columbia University. So Dasha, thank you so much again, and welcome to Charlottesville, welcome to the center. I want to just start, I mean, we're going to be in a conversation about the journeys of caregiving, and I wonder if you would mind just starting with your own journey, starting with a sense of giving us a picture of what led you into caregiving yourself, and then what led you into particularly thinking about the caregiver and their concerns.
Yeah, well, like many caregivers, I didn't sign up for it. It was completely unintentional how I ended up in this field. I was in my mid-20s. I thought I was going to be on the academic path in clinical psychology. I got my master's, and I was mentioning to a friend in passing that I was getting really disheartened in academia. All the pathologies I was learning about were detached. I was not dealing with clients directly. I was doing empirical research, and I just felt that I was not getting any kind of emotional fulfillment, not getting kind of any intellectual fulfillment, and more than anything, I mentioned to him, I just want to be of use. And I felt I really wasn't. And he said, you know, I know a gentleman who's struggling with memory loss. His son is desperately looking for somebody. And I thought to myself, and he knew I had a soft spot for the elderly, and I thought to myself, well, let's try it. This would give me an experience of really having a front row seat to seeing a neurological illness unfold in front of me instead of from a distance. And so as soon as I met this gentleman, who I call Mr. Kessler, I just immediately kind of fell for him, for his dilemma. He was very stubborn. He, like many people who had dementia, did not believe he needed any help. He thought that his son, who was worried, was just being a pain. And I thought to myself, I know how to go along with this. I think I know how to protect him. I wanted to protect him. I saw in him a very proud person, somebody who didn't want to be supported, somebody who was used to being the person who supported others. And I thought, I know how to take this role. And when I moved in, still having that kind of academic mindset, I read everything about this disease. And I learned all about the ways that the disease changes the person's brain. And as I was continuing to live with him, what really threw me is that while I expected a lot of his emotional volatility, his irrationality, his memory loss, what surprised me was how my brain was changing, and how irrational I became, how I became completely, at times I could barely recognize myself, and I was so full of contempt and self-judgment for my own reactions. Because, you know, in my naivete, I thought, well, I was going to be the sympathetic observer. And ultimately, I felt that in some ways that I had become as irrational at moments as the gentleman I was looking after. And one of the things I noticed is that I was constantly feeling hurt by things that I knew were symptoms, He would yell at me a lot of the times. He would tell me to get out of his house, that he didn't need me. And I understood very well that this is part of the disease. But at the same time, I felt so crushed by it. and then I would start scolding myself. I'm like, this is a very self-indulgent response. This is not about you. This poor man has a disease. Why are you making it about yourself and your hurt? And I felt, frankly, like such a baby. And I knew, and I read so much about this disease. And after I was done berating myself, which went on for a very long time, I began to become equally interested in my reaction. Like, why is it that I'm reacting in such a particular way? Why is it that I'm getting sucked into these situations? Why is it that somebody who, for the most part, a fairly even-keeled, I would hope, sensitive person, is carrying around this hurt when I know perfectly well what's going on neurologically? And after I left that situation, I immediately began to work with caregivers, because I wanted to give them the support, because I began to see, both in myself and the son, who I call Sam, I began to see the changes in us and the way that we mirrored a lot of the symptoms of dementia. So that's how I got into it.
Yeah, and I mean, I think one of the overarching themes of the book is that we can't think about those living with dementia separately from those who are caregivers, that it is one world in which we all inhabit. And Dominique, I wonder if you wouldn't mind sharing your story as a caregiver for your grandmother and that world that you inhabited for quite some time.
Absolutely. So I would describe my caregiving journey as, quite frankly, an emotional roller coaster. My grandmother, Geraldine Carter, was 91 years old when she passed away, and the circumstances that led up to me being a caregiver to my grandmother were very emotional for me. My grandmother raised me, and my mother did not. So when my grandmother needed my help, I felt obligated to support her in a very meaningful way till the very end. But to the detriment of my health, it was very difficult. I felt emotions such as guilt. I felt anger. I felt resentment at times. It was absolutely exhausting, and the task became quite daunting because I still had to work full-time and be a full-time caregiver. Quite frankly, it was the hardest thing I've ever had to do in my life to this very day. I've broken the largest bone in my body. I've lived in the wilderness of Alaska, working out in the villages with deaf Eskimo and Native Alaskans, and still caregiving was the hardest thing that I've ever had to do. And I think the most challenging part of caregiving was the fact that my grandmother actually had, she had about 10 children. One of them passed away at birth. She had 10 children. But I was the one, like many other families, there's always like one or two in the family who do all the work. Well, I was the one who was doing all of the work. I began to make jokes with my family members as if I'm the executive director of this caregiving journey, and I need some more aides. I need a program manager of the day program to come in during the day while I work. I need a nurse to come in at night to provide care and give me respite. So I asked for help from my family members, but no one could really provide the care that she really needed. And quite frankly, I struggled with control and power in that way, because I felt like, well, no one can do it better than me. You know, no one can really care for her the way that I can care for her. So I really struggled with accepting support and asking for support. So I'm able to ask for it, but I had a hard time accepting it. Another part of my caregiving journey was the most, I guess it was very emotional for me because I didn't have a lot of opportunity to initially take care of myself. I had a hard time understanding and balancing work and my needs and my grandmother's needs. And I still wanted to give the best version of myself to her because, again, this is someone who raised me. This is someone who took care of me from a very young age, and I felt obligated to give her that support. The guilt part of being a caregiver was when I tried to set a boundary or a limit with my grandmother and the person who was coming in to provide that respite care. My grandmother would say, "Oh, I'll be so glad when you get back." And I thought, well, Granny, I haven't left yet. Or she would say, "I don't know what I would do without you." And I thought, oh gosh, this is definitely an emotional roller coaster for me, because I struggle with, should I leave or should I stay? Ultimately, I think that what I learned too from my caregiving journey is that I learned how to set boundaries. I learned how to set limits. I learned how to, at the end, accept help. And I think that was super important. And also giving up that power and control. During my caregiving journey with my grandmother, I do have to say that the pandemic actually worked in my favor, because I was able to work from home, and I would do my work on the computer, mostly over Zoom meetings and individual sessions, 1 hour, and then the next hour I would be in the next room, spending the entire hour trying to feed her, because it was just that difficult and daunting. And then I go back to having another meeting or session, and then I would go and change her briefs, because I didn't mention my grandmother was also bedridden. Okay, the financial toll of being a caregiver certainly had an impact on me as well. I had purchased a home probably 2 years prior to my grandmother needing to come and live with me. So here I'm learning about things that I need in my home to keep her comfortable and safe. I needed a fully electrical hospital bed, and I thought all I needed to get was a Tempur-Pedic bed, but the fully adjustable hospital bed allowed me to have her go up and down, so there was no strain on my back when I changed her briefs. I could not get her into the shower so that we could complete her activities of daily living skills, like, cleaning her up. I had to do a renovation to my home. So because my grandmother actually used what we call a shower bed, and so it was obviously quite large. I thought that it would be great. I called it spa day. And every time I would say, "It's spa day," she would say, "Please don't put me in that thing." And so another part of my caregiving journey was just the idea of having to communicate with so many providers. Okay, so I neglected my own self-care, my own health and wellness, and I put hers first, because that's what I had to do. And many times I found myself just hanging on by a thread, barely making it day to day, but still wanting to give the best version of myself to the woman who raised me. And so when I look at my caregiving journey from start and where I became, or where things ended up when my grandmother passed away, I'm actually very proud, and I'm actually honored. I shared this with Dr. Mutter and Dasha yesterday. It was actually an honor and a privilege to care for her, but it was still the most difficult thing I have ever had to do in my life. Yeah.
I'm glad you brought in the discussion about having to deal with all the providers, all the people, right? It is an extraordinary amount of work. And I think one of the things, Dasha, about your book is you want us to move away from what you call the medical model of dementia and caregiving. And I'd love to just cite you here from your book, if this is okay. I think, and you would describe this model as both clinicians, I'd say even researchers, quote, continue to posit a clear distinction between the mind of the caregiver and the mind of the patient, between the normal and the abnormal, when in fact the true burden for caregivers is often the absence of such a divide. Children and spouses do not merely witness their loved one's cognitive decline, they become part of it. And I think that line resonates with many, many of us here tonight. Can you unpack that a little bit for us in terms of where you want us to go in contradistinction to the medical model?
Yeah. You know, when I wrote that, I was thinking of so many of the caregivers that would call me and they would say to me, you know, one person I cited in the book saying, everybody asks me how my husband is doing. Let me tell you, he's fine. I'm the one going crazy. And another wife called me and they said, you know, people warned me that I was not at a certain point going to recognize my husband. Nobody warned me I was not going to recognize myself. And so I think that it's this contagion of that mental decline. And the reason I say that we should step away from the medical model is that I feel that, and increasingly in academia, they're recognizing that brains, they should not study them in isolation. Our brains are designed to depend on other brains. And so when one person is declining, it's not like the other person is passively witnessing it. Our brains don't just rely on other brains because we emotionally need it. Our cognition depends on it. If somebody is not remembering, if somebody is not in your reality with you together, it's not just sad. It's extremely disorienting. And that's the reason caregivers, you know, people oftentimes said, oh, it must be so sad for you to be in this field. You're hearing so much loss, so much bereavement. And what I would tell them is actually what I'm hearing is a lot of anger, a lot of shame. And what I'm hearing is a lot of people who are transforming. The caregivers are transforming and changing because we are so dependent on the minds of others that only when you witness somebody and that person is your parent or your spouse and you could no longer depend on their mind, you will begin to see how much it affects your own mind. Because they're not in, you know, that we're in a relationship with the person. And all of a sudden, all the things that we expect from other human beings, that we're wired for, we're social animals, we rely on being connected. And when that's taken away, we're uprooted. Yeah.
Yeah. And Dominique, you were mentioning several words. I mean, I'm sure all of us can think of words tonight that reflect the emotions that we feel when we're caregiving, and that there are a few things that I think in our human experience that run the full gamut of emotions, right? But caregiving is certainly one of them, and whether it's the anger, the shame, the beauty, the wonder, all kinds of emotions. And even though fatigue isn't an emotion per se, it is certainly a state of being for many caregivers. So how do we, as you said, Dominique, give the best version of ourselves in the context of that whole picture? How do we, as caregivers, manage these emotions?
Yeah, that's a great question. I mentioned earlier that at the start of my caregiving journey, I felt like I was one person and I kind of morphed into a new person. And even though my grandmother is no longer here, the reason why I feel like I took such pride and I feel like this was the ultimate learning experience for me is because the experience truly changed my life. It changed my perspective on many things. It changed my perspective on healthcare. It changed my perspective on self-care. It changed my perspective on the cultural component of the dynamics within my family. And what I mean by that is I would often hear from some of my friends, well, why don't you just put her in a home? You just put her in a facility. And I was like, well, I can't do that. Like, that's not what she wanted. Like, she always said, please don't put me in a nursing home. You know, don't put me in a nursing home. And she worked in a nursing home most of her life. That was her job. And she didn't want that, so I wanted to honor it. So what I began to experience through all of these gamut of emotions during my caregiving journey, what I began to experience was, how do I give the best version of myself? How do I manage all of these emotions? And how do I feel satisfied and content with what I'm able to provide her. And what I came up with is self-care. Self-care, having an attitude of gratitude, and focusing on what I can control. Because oftentimes what I found myself doing early on during my caregiving journey is focusing so much attention to things that were simply out of my control. And I think self-compassion was something that I had to learn. I knew that I was doing the very best that I could do. I was definitely doing more than any of my aunts and uncles. You know, I'm sure they maybe wanted to, they didn't have the resources, the skills, the knowledge, or even, they just didn't have what they needed to give my grandmother the care that she needed. So I think all of those things, self-care, self-compassion, having an attitude of gratitude, being optimistic, and it's quite interesting because these are actually all of the things that my grandmother taught me growing up. So it was coming back in full circle. And it was quite beautiful. Along the way, it was difficult, definitely in the beginning. But as I began to exhibit things like the self-compassion and focusing on what I can control, and really being intentional about planning things to look forward to, I said to myself, I have mastered this thing called caregiving. And it became a privilege and an honor.
Dominique, could you tell us, because you mentioned in the beginning, self-care just went out the window. Could you tell us, because I know that all caregivers find it hard, what made it hard for you in the beginning?
What made it most difficult for me in the beginning was the balance and the emphasis and preoccupation with learning what to do and how to do it. And then also what made it difficult is because there was not enough time in a day. I mean, I literally felt like I was a chicken running around with its head cut off, going from appointments to talking to doctors and calling in prescriptions and setting up transportation. Because remember, my grandmother was bedridden, so whenever we went to medical appointments, I couldn't just put her in my Volkswagen Passat and think that we were going to have a comfortable ride into Charlottesville for a medical appointment. I actually had to go through her insurance company to set up wheelchair transport, and someone had to go with her. So I felt like a scheduler, and I was just managing a massive schedule of care that involved her. And there wasn't enough time to focus on me. By the time I finished all of the tasks and duties, it was time to kind of, take another hour and feed her dinner and, kind of rush to put my food down. And it was time to go to bed and do it all over again. And there were days and nights where, again, particularly in the beginning of my caregiving journey, where I thought I would cry. I would absolutely cry and thought, this is not sustainable. There is no way I can sustain doing any of this. But when I changed my perspective and I changed the actual way I was doing things, I feel like I came up with my own blueprint to caregiving from my grandmother.
Yeah, mm-hmm. I wonder, that reminds me about a particular part of your book, Dasha, where you want us to understand that there are times when it's actually extremely difficult, possibly impossible, for us to exercise certain kinds of self-compassion as caregivers. And I'm thinking in particular about memory loss, where you talk about when someone, and I'll quote you again, this is particularly memory loss for those whom we know well. You say it feels less like a neurological deficit than an act of betrayal. After all, when patients forget, it's the caregivers who end up feeling erased, their words, efforts, and sacrifices often going unacknowledged and even denied by their loved ones. And so Why is that? And how do we navigate out of that challenge?
Yeah, well, I think that, this is, again, moving away from the medical model where I used to train medical professionals or mental health professionals, and they'd always say to me, I don't understand what's going on with caregivers. I told them the person has no memory, and yet they keep on yelling at their mom and saying, don't you remember? And mental health professionals would go crazy, and they're like, I don't understand, I said it. we did an entire seminar, and to them, because they're looking at it as medical professionals, they're looking at it as a simple neurological illness, they're like, it should be clear. But of course, it's not clear at all. And what I try to explain to them is that, when you're in a relationship, you're not in a relationship with somebody's shrinking hippocampus. You're in a relationship with that person. And the way that it manifests is, Dominique, I was thinking of your grandma, like, guilting you before you go, like, are you going somewhere? There was a situation, here's a situation where something looks like memory loss, but it feels like a betrayal to the caregiver. There was a gentleman who, like you, spent going back and forth from being a lawyer to caring for his mom, back and forth, was there all the time. His mother was a very difficult personality, oftentimes dismissive, disapproved of him, disapproved of his life. But despite all that, he still showed up for his mom. And he would spend a day showering her, feeding her, talking to her. And then and just as he was about to leave, she says, oh, Big Shot doesn't have time for his mother. And he's like, Mom, what are you talking about? I was here all day. No, you weren't. Yeah, I was. We did X, Y, Z. And then a medical professional would say, what's the matter with you? That's just memory loss. She doesn't remember. But I think about you, and I think about caregivers so deeply want to take care of the person that's standing in front of them. And hearing those words is profoundly hurtful. It's not just a neurological symptom. What he's hearing is the dismissal of his efforts that he has been getting from his mother his entire life. And also, he's feeling, you mentioned guilt. As a caregiver, you're always feeling like you're not doing enough. Yes. Memory loss will make you feel that way because they forget. So all your efforts are erased, and then you're feeling like, what is enough? So I think it also depends on the relationship you have, but especially if your parent or your spouse is dismissive, then the way that they talk to you, that's professionals would say, well, that's just a symptom, can feel anything but a symptom.
Yeah. And I feel like your subtitle could have been "In Defense of Caregivers," right? Because
That's such a pithier subtitle.
I think you're trying to help us see that this is a relationship fundamentally, and we have to understand it in that through that lens. Yeah. How do we, from your perspective, how do we help healthcare professionals get there? You talk about that we need to leave the medical model. What are some of the things that you have seen either work in spaces that you've been working in, or things that you would love to see happen?
What I would love to see is that I think that a lot of us erroneously believe that if we tell caregivers, this is how you communicate with your mom, that's what they're going to do. And I think that is just as naive as saying that if I tell the dementia patient the facts, they're going to stop arguing with me and they're going to agree with me. I think that both are equally misguided. I feel that instead of us trying to fix caregivers by saying, stop arguing, it's just memory loss, I think that what we should do, and let's say that I'm going to call this person Kevin, who's the lawyer who had that difficult relationship with his mom. What I would say is, what I try to do is explore what these symptoms bring out to you. Let's stop treating these symptoms as something that caregivers could simply get over, and let's grieve with them, allow them their anger, allow them that frustration. And part of the reason I want to do that is, Dominique, you mentioned self-compassion. And that is my entire goal, is that people who have dementia, they get compassion because we have a neurological framework for understanding why they behave a certain way. And I would love for dementia caregivers to also get a certain framework that even though that these look like symptoms to the outsider, it feels so entirely different when it's your mom or if it's your husband. It doesn't feel that simple, and I would want them to see this disease not as something that is just a disease, but as an extension of a very long and sometimes fraught history between two people, and sometimes the family dynamic, as you mentioned.
Yeah, yeah. I was very fortunate at some point that my aunts and uncles, they would come by for what I call, and this might be some of the resentment still coming out, they would come by for what I call these mini visits. They would just kind of drop in for, 4 or 5 minutes to say hi, and I thought, boy, that was substantial. And so, but what they did do when they came by, again, my frame of reference truly, and my perspective had to change, because I said, okay, let me look at this and have an attitude of gratitude and be grateful that they came by. They at least came by to visit their mother, my grandmother. But they actually became sort of cheerleaders for me, because they started to see for themselves firsthand everything that went into providing appropriate and safe care to my grandmother. I think, excuse me, I think that many of them did not realize just how difficult it was and just how intense her needs were, from changing her diapers, and from taking 1 hour to get her to eat. I mean, that is it was very time consuming. And so they became my cheerleaders. They eventually started to ask, what can I do? And that felt very empowering, because I thought, well, you can sit here for an hour and feed her and talk to her. And so I think that the dynamics really changed in terms of my things changed for me, things changed for my aunts and uncles, and that also kind of changed the dynamics of our family. It's because they began to realize just how daunting and just how difficult it was to provide care, and they wanted to chip in a bit more. And that allowed my resentment to come down. That allowed my anger to kind of blow away in the wind temporarily. It also allowed me to start to focus more on myself. Okay, so yeah.
Yeah, and it strikes me that, I mean, you both kind of talked about our collective fix-it mentalities as caregivers, right? And it's very much part of our culture, of course. And of course, we want to fix things. Of course, we want things to be better. We want broken things to be whole. But there's a lot of creativity in your book. There's literature. There's storytelling, and it seems like creativity is a really important part of caregiving. Tell us a little bit about, how do we lean on that creativity? How do we make it work for us on our journeys with dementia?
I think in some ways my answer might be a little bit paradoxical in terms of how I approach this with caregivers. Dementia requires so much flexibility. You have, everything you wanted, expected gets tossed out the window, and more importantly, it requires that we kind of, people call it improv, right? Because the person who has the disease is in a different world a lot of the times. And caregivers are taught, you don't contradict them, you don't argue with them. You have to kind of step in to where they are. You have to be there in the present. And I think that the reason I'm protective of caregivers is that's very sound advice. It's extremely challenging, especially when your mind is burnt out and you're tired and you're sleep deprived. It's very hard to have that flexibility. So in that case, what do? And I feel that in some ways, especially in my support groups, what I would do is when caregivers would beat themselves up because they know they have to be patient, they have to be flexible. But again, to go back to self-compassion, what I try to do is I try to explore with them, why do you think that you just couldn't do it? Why do you think you blew up at your mom? Why do you think your husband saying that line to you is what made you blow the fuse and you couldn't step into his reality? And by shifting the attention on them and giving them the nurturing and the attention, I think that and allowing them to have a little self-compassion. Oh, that's why I did that. Maybe I'm not a terrible person. Maybe I just had a moment of weakness. And I think that the more, because our brains are so intertwined, the more self-compassion a person could have for themselves, the more they're capable of giving it. And so my goal is always to be nurturing to the person who's providing care, provide care to the caregiver, so then they could bring it back to that person in the same way that you said that once you got a little support from your family, once you got it, then everything opened up for you. And so I think that instead of lecturing caregivers and you have to be flexible, that's all well and good, but if it's 2 a.m. and your mom has gotten up 13 times and she's saying that she's getting the hell out of the house and she's screaming bloody murder, there's only so much capacity you might have at that moment to roll with the punches and be flexible. And so I feel like instead of lecturing caregivers, let's give them the nurturing that they need to provide for their care receivers.
And you purposefully titled your book Travelers to Unimaginable Lands, which I think is a very interesting selection of words. Like, first of all, we're travelers, right? That this is a journey. Yeah. It is not something where we have a clear path right out in front of us with clearly demarcated lines to follow. But I was always curious why you chose unimaginable. And as a healthcare provider, one of the things that we always talk about is uncertainty and how do we be okay with uncertainty, especially in the context of someone living with dementia and how we help them on that journey. But why unimaginable? Why?
Oh no, the reason might disappoint. It's a line that I took from Oliver Sacks. Yes. He described his patients as travelers to unimaginable lands. And that line always stuck with me. I loved it because it encapsulated everything I love about Oliver Sacks. Because to him, his patients were not patients. They were not people who are just who have deficits or compromises. They are travelers, and they have things to teach us. Yeah. And I feel that caregivers must travel with the patient, and they have things to teach us as well. So instead of trying to educate them, like, oh, this is what you should do with your mom, let them educate us, because we have a lot to learn. And I think that we have a lot to learn, not just about their incredible capacity. When I listen to you, I'm just thinking you have so much resilience, but we also have a lot to learn about when things go awry, when they are not at their best. Their anger could teach us, their inflexibility can teach us, because essentially we're learning about how two minds navigate this incredibly difficult situation. So for me, I feel like it's not just the patient that's fascinating, and everybody, neurological case studies, they're always about the person who has the disease. We naturally think that mind is fascinating. I'm like, no, the person, it's not just about the man who mistook his wife for a hat. It's the wife. What is it like for her? Her husband mistakes her for a hat. That's wild. What is it like to live in her world? And so I just think that the caregiver's mind and their struggles could be just as informative and just as amazing as the person who has the disease, and just as interesting.
Absolutely, absolutely. Well, we now have time for questions from the audience. We'll bring a microphone around, so please feel free to raise your hand if you'd like to ask a question, and we will bring the microphone to you.
Thanks, a wonderful session. My question relates to folks early in their journey with dementia. Could you describe sort of your thoughts about how you engage in an activity where they might be having some challenges, but they still want to do? For example, driving or something like that.
So it is a set of travels to unimaginable lands for sure, and I think part of it is, as we all, as Dasha is encouraging us in this book, living in that space together and trying to navigate it day by day, depending on whether the question is driving versus not. And of course, as a physician, I would say, well, there are objective situations where my recommendation needs to be focused on safety in certain circumstances. But as Dasha is teaching us, that's one thing to say. It's another thing to live out in the context of relationship. And so I think being attentive to that and understanding that it's not a conversation that we're going to have over 30 minutes in a clinic visit, right? That especially for caregivers and for persons living with dementia, that is going to be a conversation that is happening potentially repetitively on a day-by-day basis, and we need to embrace that and walk that road together, as challenging as it might be.
I'm used to hearing this question from caregivers, and so I always ask the caregiver to make sure that the activities that the person wants to do is what they want to do rather than what you want them to do. Because when I was listening to you speak yesterday, I thought there's so many things you want that person to be okay. You want them to be their old self. And I think it's about making sure that whatever it is that they're engaged in is not something that is going to satisfy your emotional needs for them to be normal and like their old self, and is about where they are and what they want. And it's a very hard thing to tease apart. And oftentimes I find that caregivers drag the care receiver to events and places that they actually don't want to go to, just because it makes them feel like, oh, things at least are still normal. Mm-hmm. And I don't know, do you feel that?
It reminds me of a story with my grandmother. Typically, so my grandmother went for a neurocognitive evaluation, and of course we waited weeks for the results. We went back in for the appointment to hear the results. And my grandmother was still driving at that time, but she was having little minor, no accidents, we'll call them kind of incidents or almost, accidents. And so when the results came back in, my grandmother and I were sitting there, and ultimately they suggested that she not drive anymore. And they said, well, we can't force you, but this is just our recommendation. And I was pissed. And my grandmother was like, thank you, Jesus. So when we got in the car, I'm like, Granny, like, what do you mean, thank you, Jesus? You still have a car. It keeps you, independent in the community. You're still like going to the grocery store. You're staying active. And she was like, but yeah, I'm tired of driving. And I thought to myself, well, I cannot believe this. I said, we didn't. And so it's interesting because I wanted her to still drive. Of course. And because I wanted her to, I felt like driving would keep her living longer, keep her more independent. And I had to respect the fact that that's not what she wanted. She actually felt scared to drive, even though she was only going within the town limits. She was actually very scared to drive. So she started to decrease how often she went into the community to run errands at that time. So I just thought it was quite interesting. And it took me a while. I emailed the doctor, and I just couldn't get over it. I was like, we're supposed to be teaching her how to remain independent, and this is going to make her decline quicker. And so it's interesting that we talk about the driving and the insight and what we want for them. There's definitely can be a conflict at times. Yeah.
Other questions?
Hi, I had a question for you. In the book, most of the caregivers you talk about have a very close relationship with the person with dementia, a child or a spouse or something like that. One of the things I was curious about is what you describe in the book. Do you see that happening in caregiving situations where the caregiver is a little bit more removed? Does that sort of mirror neuron phenomenon still happen, or are those less fraught journeys for each party?
Oh, that's an interesting question. I think that given the work, I have a very biased sample of caregivers, because the people who go to me for support, the people who are feeling exhausted, are the primary caregivers. So those are the people I work with the most. Of course, I think that there are so many caregivers that are not, who are not as entrenched. And for them, dealing with dementia in some ways is easier. I remember Dominique, I remember that you were saying that your family, in some ways, even though actually had more insight sometimes about you taking a step back than you did, because you were right there.
Yeah.
Yeah.
Yeah, I was definitely right there in the trenches and trying to be superwoman, but I was, I was failing. I was keeping my head above water, but I was certainly drowning at some points.
And it was your family that said, you've got to let go.
Yeah.
And I always say that it's so much, and you said how they were so right. And I said to you, it's easy for them to be right because they're just detached, right? So I think that it's the primary caregiver is always going to be the one that looks, that is a little bit more crazed and falls prey to this disease.
Yeah,
because
I
they
feel
don't have the
like
luxury.
speaks to your global point that when we see caregiving in context, not just in the context of family, but anybody who's involved in the care, friends and other loved ones, organizations, right? That suddenly we can be open to all kinds of things that can come to illuminate how we care for someone and how we better care for someone. And so being attentive to that context, whether it's someone that is a sometime caregiver or sometimes an everyday caregiver, can really help us navigate the way forward.
Yeah, a lot of factors. I mean, of course, this would be part two, but I was also a caregiver to my mother, who I was not very close to. I mean, she didn't raise me. My grandmother raised me. But my grandmother's personality and my mother's personality were very different. My mother felt entitled, and my grandmother was always expressing gratitude and always just, saying thank you for everything that you do for me. And she was actually, her body was failing, but her mind cognitively things kind of ebbed and flowed, because she would have this tremendous amount of insight at times that was quite amazing. So getting back to my mother, the dynamics of that were probably a bit more painful, because she was, she felt entitled, and her needs, although she was mobile, she could use a rollator, she could, she could still do a lot of things in the community and wanted to and expected me to. Her personality was just very, very different. And she had very little insight into management of her renal disease and eating the right foods and watching the liquids, whereas my grandmother was very different. Yeah.
Questions? I know there are hands up.
Hi there. Thank you so much for being here today. I really liked the point that you made that our minds are kind of all of one being because we evolved that way socially. I'm curious if, similar, we say it takes a village to raise a child. What is the burden of, or the experience of caregiving look like if you have more of a team approach? Have you seen that happen, or do you have any thoughts about what it might mean to share that amongst maybe a family or a larger group of people versus it coming down to a single individual?
Mm-hmm.
Oh gosh, that's a biggie. I wish that was the case. I wish we saw dementia as stepping away from one person bearing the entire brunt of it and making it more a societal issue. I know that the UK has like Alzheimer's cafes, and I would love to see that, where it's not just your extended family that could help, although that would be a huge boon to any caregiver, because usually that's not the case. But if also Alzheimer's were somehow incorporated into society, that you were not, because what happens is that Alzheimer's creates an epidemic of isolation, not just for the person who has the disease, but then their caregiver. All caregivers tell me, my life has become very small, and I have become a boring person that has nothing to contribute and nothing to say. And to me, that is the most heartbreaking thing. And I feel that if only we could take caregivers and dementia patients into the world where they could socialize, where they could just be. It doesn't have to be Alzheimer's organizations, which in fact oftentimes are avoided, especially in certain communities. So I wish it was, as you say, I wish it was a village. And that way caregivers wouldn't have to suffer the double whammy, which is first my husband gets Alzheimer's, and now I have no life, and now I'm completely cut off from the world, and now I'm cut off from myself.
I mean, I think that's where many families struggle.
Yeah.
Is that's one of the biggest issues, is getting everyone on board to do their part. I facilitate an elder care support group for UVA employees, and I often hear the resentment and the anger of the members in the group toward their siblings. They're gone, they're on vacation, they're doing all the things that they want to do, but they don't want to help care for our mother or our father or a grandparent. And so oftentimes, too often, my experience is that it's always a few in the family that do a significant amount more of work and provide a lot more care than others in the family.
Very true.
But you're right, it does take a village.
And you asked, how do we build flexibility for caregivers? Well, if they're so disappointed by their family not showing up, by society at large leaving them alone, when you feel isolated, your ability to have that cognitive flexibility to roll with the punches, it only decreases. So I feel like instead of asking caregivers, what can you do better? I think we should ask ourselves, what could we do better for them? So they have that emotional capacity to actually work at their best.
Other questions? Yeah, I know there are lots of hands.
Thank you for that question.
Can you talk a little bit about the person being cared for, if they were an abuser of the person who's now caring for them? That adds a whole nother layer. Unfortunately, my family experienced that. So can you tell us so other people can learn from what you would advise?
It's very heartbreaking because I do see that. I don't have personal experience with that sort of theme, but I hear it often from caregivers who, one, weren't raised by their parent, didn't have a close relationship. Quite frankly, they don't really know them that well. And they didn't have contact over the years, or they experienced some sort of abuse by the person they're needing to provide care to. It is probably more challenging. It's probably a very, significant and challenging part of being a caregiver. I personally can't speak to that, but I would imagine that is extraordinarily difficult, because you're basically being asked or feeling obligated or needing to do something for someone and show them love and nurture and give them your time, but they didn't do that for you. So it's like helping the abuser. That's really tough. That's a tough spot or space to be in.
I'm so glad you brought up that question. I was actually, it's one of the pieces I'm going to be working on next, is how do you navigate when the relationship was really abusive? And I'm particularly protective of the caregivers in that situation. There's the human part of me wants to go run, get away from that situation. Of course, that's not the way, for various reasons. Oftentimes, the person who has been abused by the parent or by the spouse finds themselves in the caregiver role. And one of the things that I really want to stress to them, and again, this goes back to not looking at symptoms in a very clear medical way, is that the symptoms, if we look at them, are actually extremely abusive. What does an abuser do? They gaslight you. What does an abuser do? They invalidate your efforts. What does an abuser do? They contradict you. They never apologize. Well, when you have dementia, you have no memory. Your inhibitions go down. You're supposed to accept the lack of moral accountability because oftentimes they simply can't do it. So a lot of the abuser's tendencies are actually very similar to dementia patients. So not only do you have this very fraught relationship with this person, but also the disease could present itself in a very abusive way, and you don't have the model they've never taught you that flexibility. They've never taught you how to take care. And so you're now supposed to do it. And so when I've had caregivers in that position, I really lay it down on the table, because I don't want them to question themselves. I don't want them to think that they're going crazy. I actually really say, this disease can feel very abusive. And I think that it's very important that they know it and that they don't question themselves, because that's so much the power of an abuser, is they make you, is they deny, they deny, they deny. So I think that's one of the things, is to frame it for that person, that what you're feeling is completely valid. This is a maddening situation and it's extremely unfair. And it's not right that you're in it, but you are in it. So let's try to work together to get you through it.
Yeah. If I were in that situation, though, I mean, I provided care to my mother. She wasn't an abuser, but she didn't raise me. She was sort of, kind of in and out of our lives for these short visits. But if I were, that made me think, if I were in that position, because of what I learned during my caregiving journey, which is knowing how to set boundaries and limits, knowing how to finesse putting myself first, because one of the greatest metaphors we hear the metaphor we hear when we take a flight is put on your mask first before you help others. And in my profession and my family and my culture, I actually was kind of taught the other way around.
Right.
Help everybody else and then worry about yourself last. But what I've been able to finesse during my caregiving journey is just the opposite. Okay, and that is how I became so good at focusing on self-care. So if I were in a position where I was asked or thought I had to care for an abuser, I very likely would not do it. And that would be my boundary. That would be my boundary. And I'm not saying I would just abandon them. I would support them in a different way, by exploring options for maybe a facility, and me possibly going to visit if that felt healthy for me. But I think that would be a boundary I would set, and definitely try my best to stick to it.
That would be the ideal.
Mm-hmm.
What I find a lot of the times with caregivers, they want to do that, but because abusers can be extremely good at making you feel guilty
Manipulation.
about leaving them, abandonment. So what you said about boundaries is so important. I would be really working with that person more than the average caregiver to establish those boundaries, to establish self-care, and to let them really understand what's at stake. Like, this is a treatment. Your self-care is not a luxury. And to have a plan with them of how do you set those boundaries and to process how this experience is feeling. So boundaries are the key.
And another reason, as we were saying earlier with the earlier question, to envision that care as a social responsibility, not just a responsibility in the context of a single relationship or a series of relationships. We have time for just one more question, unfortunately. Anybody wants to be the last?
Yes, I have a friend that has been taking care of his wife 24/7, and they've always been very close and lovey-dovey. And sometimes he'll bend down to kiss her goodnight, and she'll just haul off and smack him. Mm-hmm. And it really hurts him. And I was just wondering, how does the caretaker cope with that?
You go ahead.
So the question is, how do you cope with something? My heart goes out to your friend. I think that a lot of the times, I think that we say, I would say it's okay that he's not coping with it. When a relationship that's so dear falls apart that way, and the person you love so dearly smacks you in the face, I think that the first step is to really allow him to feel that loss and to really listen. Because I think what's happening is that he's lost a partner who once listened to him. Forget even about the smacking, which is so hurtful, but the fact is that he no longer has that connection. So speaking of taking a village, I think that the most important thing that we could do for that caregiver is to give him that support that he once had with his wife, and to make him understand that his pain is not an irrational reaction or his anger or his sadness, that it is actually absolutely normal, that that is a form of bereavement that he has, and it's not something that he should get over. It's okay, and it's okay that he's not coping with it because it's painful.
Yeah. I just want to add that this sounds like a situation where it is of the utmost importance that your friend he receives support. I mean, because it's not sustainable, obviously, and identifying resources through some of the social agencies in the community, JABA, possibly family members, neighbors, friends that can give him an opportunity to get a break. Yeah, to get a break. And also just thinking sort of out of the box, if resources are, abundant or they're not an issue, possibly having an aide, if he notices there's a trend in when she's more aggressive than others, maybe having an aide come in during that time to see how she responds, or he responds to someone differently. But ultimately, your friend obviously, definitely needs support. Yeah, I'm really sorry that he's going through that. That's really tough to be abused by someone that you're trying to provide care to. It's very difficult.
Well, I want to, unfortunately, we have to close. I want to thank everybody for your participation, for attending, both those who are with us here in the live audience and those who are with us on Zoom. I want to thank Dasha Kiper for coming and spending your precious time with us here in Charlottesville. Thank Dominique for your many words of wisdom and insight. I want to thank several people here at the end who've just really been amazing and helping us put this together. Charlene Kaufman in the back, really just amazing work from our medical center hour administration. So give her a big high five as you're leaving. I want to also again thank our wonderful collaborators here at the center. Many people. I won't name them all, but give them a high five as well as you're leaving. And I want to say one of the things we love to say at the end of every medical center hour is these are conversations that are starting. These are not conversations that are finished. And so please go out from this event, this conversation, with this information. Share it with your loved ones, your networks, the groups that you're a part of, and continue on this journey to understand how we can better care for each other. Thanks so much.
Thank you.